Antidepressants are used to treat depression. It is very important not to suddenly stop taking an antidepressant in order to prevent discontinuation syndrome. Discontinuation syndrome includes various symptoms such as anxiety, feelings of sadness, headaches, dizziness, and nausea and vomiting. If you have been taking an antidepressant such as paroxetine or sertraline for longer than 6 weeks and you suddenly stop taking your medication, then you may experience discontinuation syndrome. I do want to mention that antidepressants can take several weeks to become effective. Therefore, it is important not to stop taking your medication if you do not initially see a response. If you want to stop treatment, ask your doctor. If your doctor has agreed to stopping your medication, then your doctor will gradually lower your dose until your medication is stopped. Your doctor will work with you to develop a plan to lower your dose over about 2 to 4 weeks. Generally, the antidepressant dose will be reduced by about 25% per week until the medication is stopped. It is important to let your doctor know if you're experiencing any feelings of sadness or your depression begins to worsen while your medication dose is reduced. As with any medication, ask your doctor or pharmacist any questions you may have. Up to 10% of people report being allergic to penicillin or the penicillin class of antibiotics, making it the most commonly reported drug allergy. If you're allergic to penicillin, it is recommended to avoid medications in the same antibiotic class, such as amoxicillin and ampicillin. Certain antibiotics that should be used with caution in penicillin allergic patients include drugs in the cephalosporin class, such as Keflex. Cephalosporins have a low rate of causing an allergic reaction in people who are allergic to penicillin, but their use should still be monitored in these people. Remember, just because you show allergic symptoms after taking penicillin doesn't mean that you will react to related drugs such as amoxicillin, but it increases the chances that you might. Also, just because you had a reaction to penicillin or any other drug at one point doesn't mean you will have the same reaction later on. The best decision is to always watch for signs of an allergic reaction, such as rash, hives, or trouble breathing. Make sure to contact your doctor if you have signs of an allergic reaction and seek medical care if you have difficulty breathing. Always let your pharmacist and doctor know if you have a penicillin allergy.
How to perform hands-only CPR. Cardiac emergencies can happen anywhere. Be prepared with a simple technique known as hands-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. You will need the willingness to act and a few simple skills. Whenever possible, use disposable gloves when providing emergency care. Step 1. If you see someone suddenly collapse, check the scene for safety and then see if the person responds to you by tapping them on the shoulder and shouting, "Are you okay?" Step 2. Briefly look for breathing. Step 3. If they don't respond, call or send someone to call 911 or the local emergency number right away. Step 4. If the person is not breathing or is gasping, prepare to give chest compressions. Kneel beside them and put the heel of one hand on the center of their chest. Place your other hand over that hand, lacing your fingers together. Position your shoulders directly over your hands, keeping your arms straight and your fingers off the chest. Step 5. Push hard and fast, at least 2 inches, then let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Step 6. Keep going. Do not stop compressions until the person shows an obvious sign of life like breathing. The scene becomes unsafe. An automated external defibrillator or AED is ready, you're too exhausted to continue, or a trained responder takes over. Step 7. Get training and encourage others to do so by taking an American Red Cross health and safety course. Knowing full CPR, chest compressions, and breaths will enable you to help in other emergencies such as drowning and choking. Every household should have at least one person trained in life-saving skills. Did you know? Most people who survive a cardiac emergency are helped by a bystander. To find your local Red Cross chapter, visit redcross.org.
I'm Katie, and it took me 19 years to figure out that I had Lyme disease. I'd always had health issues, my whole life from when I was young. Sinus problems, poor immune system. It was my freshman year of college. I kept getting pneumonia like every week or two. And then all of a sudden it was like 20 hours a day of sleep or I couldn't get up to move. I felt so out of control. I stopped going to my classes because when I was at my classes, I couldn't really process the information. I wasn't hearing the questions. I wasn't able to keep up with the reading. There was just something missing. There was no specific note that the doctor at Washington and Lee could give me because she didn't know what was wrong either. I had to go through at least 15 doctors. It started with pneumonia, walking pneumonia, chronic walking pneumonia, Epstein-Barr virus, mono, fibromyalgia, POTS, chronic fatigue syndrome, generalized anxiety disorder, and depression. I didn't know what it could be. So then having someone say, you need to see a psychiatrist, it was half, fuck you, no, but also, okay, this man has 8 degrees on his wall. And I certainly doubted in moments that I was making everything I was experiencing up. They made me feel like I wanted attention. I thought I was going to die. The suicidal thoughts crept in. I really think that what kept me going was wanting to see where the mystery went. I wanted the answer, and I kind of never lost sight that I would receive that eventually, and that I would prove somebody wrong. I'm stubborn, I'm real stubborn. It wasn't officially until a sports masseuse who was working on my body and hearing all of my trials and tribulations said, have you looked into this? I hear it's very hard to diagnose and you have to be very firm with doctors in order to get them to test for it. I was like, okay, here we go. And I went and I found any doctor that would take it seriously, one of whom diagnosed me and the other of whom treated me. And my doctor, who was taking this very seriously, held my hand for the first time since I had gotten sick and said, this is not easy and this is not straightforward, but I'm gonna try really hard and we're gonna figure this out for you. That moment of, this is what you have a name, you can write this down on your paperwork, you can tell this to loved ones, we have a path, and maybe it's not super clear, and we're gonna have to switch around your medications a lot, but you have this thing, and you have not been crazy this whole time. It was a stunning moment. It gave me the fuel that I needed to go forward with treatment for over a year with intensity. I would be throwing up so much, have no appetite, and look like complete shit. And I would just smile so much because I knew that the medication that was making me sick was doing something, and that's why I was getting sick. And it was this whole process in my brain, like a challenge. Like I was fighting these bugs that were in my body. Having a goal versus just going down and thinking that you're crazy. They're incomparable. And it gets easier the further I get away from my former self, because letting go of her has been very difficult. Hearing from doctors and hearing from loved ones is always reassuring, and getting an answer or getting support is what we all want, but no one will ever know what's going on inside of your body or going on inside of your brain unless you tell them. And in order to tell them confidently, you have to have been listening to yourself. Anything that seems abnormal to you, listen to it and remind yourself that you are worth paying attention to yourself. And if you don't understand and believe yourself, no one else will.
Can you read in the car? If so, consider yourself pretty lucky. For about 1/3 of the population, looking at a book while moving along in a car, or boat, or train, or plane quickly makes them sick to their stomach. But why do we get motion sickness in the first place? Well, believe it or not, scientists aren't exactly sure. The most common theory has to do with mismatched sensory signals. When you travel in a car, your body's getting two very different messages. Your eyes are seeing the inside of the vehicle, which doesn't seem to be moving. Meanwhile, your ear is actually telling your brain that you're accelerating. Wait, your ear? Yeah, your ear actually has another important function besides hearing. In its innermost part lies a group of structures known as the vestibular system, which gives us our sense of balance and movement. Inside, there are 3 semicircular tubules that can sense rotation, one for each dimension of space. And there are also 2 hair-lined sacs that are filled with fluid. So when you move, the fluid shifts and tickles the hairs, telling your brain whether you're moving horizontally or vertically. With all these combined, your body can sense which direction you're moving in, how much you've accelerated, even at what angle. So when you're in the car, your vestibular system correctly senses your movement, but your eyes don't see it, especially if they're glued to a book. The opposite can happen too. Say you're sitting in a movie theater and the camera makes a broad, sweeping move. This time, it's your eyes that think you're moving, while your ear knows that you're sitting still. But why does this conflicting information have to make us feel so terrible? Scientists aren't sure about that either, but they think that there's an evolutionary explanation. You see, both fast-moving vehicles and video recordings have only existed in the last couple of centuries, barely a blink in evolutionary time. For most of our history, there just wasn't that much that could cause this kind of sensory mix-up, except for poisons. And because poisons are not the best thing for survival, our bodies evolved a very direct, but not very pleasant way to get rid of whatever we might have eaten that was causing the confusion. This theory seems pretty reasonable, but it leaves a lot of things unexplained, like why women are more affected by motion sickness than men, or why passengers get more nauseous than drivers. Another theory suggests that the cause may have more to do with the way some unfamiliar situations make it harder to maintain our natural body posture. Studies have shown that being immersed in water or just changing your stance can greatly reduce the effects of motion sickness. But again, we don't really know what's going on. We all do know some of the more common remedies for car queasiness, looking at the horizon, chewing gum, taking over-the-counter pills, but none of these are totally reliable, nor can they handle really intense motion sickness. And sometimes the stakes are far higher than just not being bored during a long car ride. At NASA, where astronauts are hurtled into space at 17,000 miles per hour, motion sickness is a serious problem. So in addition to researching the latest space-age technologies, NASA also spends a lot of time trying to figure out how to keep astronauts from vomiting up their carefully prepared space rations. Much like understanding the mysteries of sleep or curing the common cold, motion sickness remains one of those seemingly simple problems that, despite amazing scientific progress, we still know very little about. Perhaps one day the exact cause of motion sickness will be found, and with it, a completely effective way to prevent it. But that day is still on the horizon.
Take a moment to read the following. How was that? Frustrating? Slow? What were those sentences about? They're actually a simulation of the experience of dyslexia, designed to make you decode each word. Those with dyslexia experience that laborious pace every time they read. When most people think of dyslexia, they think of seeing letters and words backwards, like seeing B as D and vice versa. Or they might think people with dyslexia see saw as was. The truth is, people with dyslexia see things the same way as everyone else. Dyslexia is caused by a phonological processing problem, meaning people affected by it have trouble not with seeing language, but with manipulating it. For example, if you heard the word cat and then someone asked you, remove the C, what word would you have left? At. This can be difficult for those with dyslexia. Given a word in isolation like fantastic, students with dyslexia need to break the word into parts to read it. Fan, tas, tick. Time spent decoding makes it hard to keep up with peers and gain sufficient comprehension. Spelling words phonetically like STIK for stick and FRENS for friends is also common. These difficulties are more widespread and varied than commonly imagined. Dyslexia affects up to 1 in 5 people. It occurs on a continuum. One person might have mild dyslexia, while the next person has a profound case of it. Dyslexia also runs in families. It's common to see one family member who has trouble spelling, while another family member has severe difficulty decoding even one-syllable words like catch. The continuum and distribution of dyslexia suggest a broader principle to bear in mind as we look at how the brains of those with dyslexia process language. Neurodiversity is the idea that because all our brains show differences in structure and function, we shouldn't be so quick to label every deviation from the norm as a pathological disorder, or dismiss people living with these variations as defective. People with neurobiological variations like dyslexia, including such creative and inventive individuals as Picasso, Muhammad Ali, Whoopi Goldberg, Steven Spielberg, and Cher, clearly have every capacity to be brilliant and successful in life. So here's the special way the brains of those with dyslexia work. The brain is divided into two hemispheres. The left hemisphere is generally in charge of language and ultimately reading, while the right typically handles spatial activities. fMRI studies have found that the brains of those with dyslexia rely more on the right hemisphere and frontal lobe than the brains of those without it. This means when they read a word, it takes a longer trip through their brain and can get delayed in the frontal lobe. Because of this neurobiological glitch, they read with more difficulty. But those with dyslexia can physically change their brain and improve their reading. With an intensive multisensory intervention that breaks the language down and teaches the reader to decode based on syllable types and spelling rules, the brains of those with dyslexia begin using the left hemisphere more efficiently while reading, and their reading improves. The intervention works because it locates dyslexia appropriately, as a functional variation in the brain, which naturally shows all sorts of variations from one person to another. Neurodiversity emphasizes this spectrum of brain function in all humans and suggests that to better understand the perspectives of those around us, we should try to not only see the world through their eyes, but understand it through their brains.
It's great to be prepared for the upcoming flu season. The Centers for Disease Control and Prevention recommend a yearly flu vaccine for everyone 6 months of age and older as soon as it becomes available. Many pharmacies and doctors' offices receive the flu vaccines in August. This is a great time to receive the vaccine because it takes about 2 weeks for it to become effective, and flu season generally begins in October. The CDC expects shipments of the flu vaccine to begin as early as July or August. I would recommend checking at your local pharmacy or doctor's office in August to see if they are available yet. As with any vaccine, ask your pharmacist and doctor any questions you may have.
Following these 10 simple steps can help you keep up with your medications and prevent medication errors at home. Number 1, be involved in your healthcare by always asking your doctor and pharmacist questions about your medications. 2, keep an updated list of all medications you take, including over-the-counter products and herbal and nutritional supplements. 3, never place your medications in one bottle. Always keep them separated. 4, always read the prescription bottle to follow the directions your doctor and pharmacist have given you on how to take your medication. 5, if you need to use a measuring device to take your medication, always use the appropriate one. 6, to ensure you're taking medications as prescribed, you can use a weekly medication pill organizer. Also, always take your medications with a light on and never in the dark. 7, be sure to relay any information on allergies or previous issues with medications to your doctor and pharmacist. 8, dispose of all medications appropriately that you are no longer taking or have expired. 9, always get your medication refills on time to avoid missing any doses. And 10, try to use the same pharmacy and the same doctor. When your child is experiencing diarrhea with or without vomiting, large amounts of fluid are lost from the body, which can lead to a more serious condition called dehydration. When looking for ways to keep your sick child or baby hydrated, many parents turn to Gatorade. Although Gatorade and Pedialyte may seem similar, they actually have quite a few important differences. Gatorade and Pedialyte are 2 different electrolyte solutions. Doctors recommend Pedialyte over Gatorade because Pedialyte contains the right amount of sugar in balance with sodium to help regain what your child has lost through diarrhea and vomiting. It is formulated to contain a good balance of minerals and nutrients. Pedialyte contains sodium, glucose, potassium, chloride, and zinc. With that being said, Gatorade products are not usually recommended for children under 2 years of age because the sugar content is very high. In addition, Gatorade is low in sodium, which is an important electrolyte lost during diarrhea and vomiting. In fact, sugary drinks may actually make the situation worse and cause more diarrhea and in turn increase the risk of dehydration. Talk to your doctor or pharmacist to determine the right amount of Pedialyte for your child.
Some tablets will have a score mark, which is a groove across the middle of the tablet so that it breaks evenly. Some tablets are still difficult to break by hand and may require the use of a pill cutter. Pill cutters are great tools because they easily split tablets into even pieces and keep the pieces from being lost after splitting. You can buy pill cutters at your local pharmacy for a few dollars. Most pharmacies will split your tablets for you if you request it ahead of time. Before you cut your tablets, make sure to ask your pharmacist if your medication can be split. Certain medications should not be cut, split, or crushed. These medications include medications that are longer acting, such as ER, XR, or SR formulations. Cutting these tablets will affect how your medication works. As with any medication, talk to your pharmacist if you have any questions.
Do you know the game plan for beating a stroke? A stroke happens when blood flow to part of the brain stops. If this lasts for long, cells can die, causing permanent damage. Fortunately, there's a quick and easy way to recognize a stroke. It's called FAST. FAST stands for face, arms, speech, and time. Check the person's face. Does it look uneven? Are they able to smile normally? Is one arm hanging down or weaker than the other? Does the person's speech seem strange or slurred? Time is critical. If you observe any of these symptoms, call 911 immediately. If you follow this game plan, you can save a life. Just remember to act fast. Face, arms, speech, and time. To learn more, please visit stdavids.com/fast.
Dear 16-year-old me.
Dear 16-year-old me.
Dear 16-year-old me.
Please don't get that perm. It's not as awesome as you think it's going to be.
You have to actually practice in order to learn to play guitar.
Whiskey tastes even worse on the way up.
Dear 16-year-old me. There's going to be a new set of Star Wars movies. Don't watch them. They ruin everything.
Dear 16-year-old me. This is where they took the cancer out. It was something called melanoma.
It's called malignant melanoma.
Malignant melanoma.
Malignant? That's not a very friendly word.
You'll be diagnosed when you're 28.
18.
36.
29.
22.
It's a tumor that starts in your skin cells, the cells that give your hair and skin color.
It's not just skin cancer.
Well, it is.
Well, it is.
But not just the
cut it out and it'll be fine kind, unfortunately.
It's the kind that you have to catch before it spreads.
Because it spreads so fast.
So fast.
To places like your liver, your lungs, your brain.
Yours will be a really rare kind in your left eye, and that's when you'll find out.
That melanoma can show up on your tongue, the palms of your hands, and the soles of your feet.
Your doctors will tell you you're lucky that you caught it early.
Yours will tell you that you need aggressive treatment.
I'll have to tell you it might take a year of chemotherapy.
And you'll need to do some of the injections yourself.
Dear 16-year-old me.
You're doing okay.
You're strong.
But there are some things I want you to know.
I wish I'd known.
That one bad sunburn before you turn 18
doubles your chances of developing melanoma.
That fair skin and red hair means that you're at a higher risk of getting it.
As if ginger people didn't have enough problems.
That you're at higher risk if you've got more than 50 moles.
And if you have a weakened immune system or a family history of skin cancer.
I want you to know the outlook is very good if we can catch it early.
But you have less than a 10% chance of surviving more than 5 years if we don't.
Dear 16-year-old me.
Spend more time with family. They mean everything.
If I had one piece of advice for you, don't start the tanning bed. I know you want a healthy glow, but it's going to double my chances of getting melanoma.
Sunscreen.
Yes, I agree. It's a huge pain in the ass, but so worth it. Please.
Your skin's like an elephant. It never forgets.
Dear 16-year-old me, helping spread this message is how you'll honor Glenna's memory. At 16,
She's already an incredible lifeguard. She loves the sun and the beach and tanning, but she just doesn't know.
She'll be diagnosed when she's 22 and will lose her battle when she's just 26.
I want you to know, because it's melanoma that's going to take the strongest man you know, your best friend, and the love of your life.
Dear 16-year-old me,
Don't be afraid. This isn't about being afraid.
I want you to be aware
that melanoma is a young person's disease.
It is the second most common cancer in children and teenagers, and one of the most common in young adults.
And it can be deadly.
I want you to know you're not helpless.
This is a cancer that shows itself
right there on the outside of you.
Start checking your skin.
Please check.
Get to know your skin.
Get to know your skin.
Start checking your skin.
If a new mole shows up,
or if one you have starts to change color,
or size, or shape,
or feels different.
If something seems out of place, get your doctor to have a look as soon as possible.
Know what to look for and get help. These are all signs your skin could be developing cancer.
You brush your teeth every day, maybe even floss.
Okay, we both know you don't floss.
But just once a month, I want you to check.
It takes 10 minutes.
10 minutes.
Dear 16-year-old me, I do realize you're not actually going to see this, but someone else will, and it'll make a difference to them.
Dear someone else.
Dear somebody else.
If you're watching this,
send it to a 16-year-old you care about.
Send it to anyone who was once 16.
Or soon will be 16. Send this.
And check yourself. Educate yourself.
You can download tools and information about melanoma here.
Share this link.
Tweet this link.
Post this to your Facebook.
Most people turn towards over-the-counter decongestants when they have a stuffy nose or congestion. Unfortunately, if you have high blood pressure, you should avoid these medications. That is because decongestants work to relieve congestion by shrinking blood vessels in the nasal membranes of the nose and air passages. These changes may affect blood vessels in locations other than the nose, resulting in increased blood pressure. Decongestant examples are pseudoephedrine, phenylephrine, and oxymetazoline. Decongestants in oral and nasal form can affect your blood pressure, so it is recommended to try alternative options. Saline nasal spray is a great option to flush your sinuses. Drinking plenty of fluids, especially water, and getting rest are also important steps to helping your congestion. If you still experience bothersome nasal congestion, talk to your pharmacist or doctor for advice.
The largest organ in your body isn't your liver or your brain, it's your skin, with a surface area of about 20 square feet in adults. Though different areas of the skin have different characteristics, much of this surface performs similar functions, such as sweating, feeling heat and cold, and growing hair. But after a deep cut or wound, the newly healed skin will look different from the surrounding area, and may not fully regain all its abilities for a while, or at all. To understand why this happens, we need to look at the structure of the human skin. The top layer, called the epidermis, consists mostly of hardened cells, called keratinocytes, and provides protection. Since its outer layer is constantly being shed and renewed, it's pretty easy to repair. But sometimes a wound penetrates into the dermis, which contains blood vessels and the various glands and nerve endings that enable the skin's many functions. And when that happens, it triggers the 4 overlapping stages of the regenerative process. The first stage, hemostasis, is the skin's response to 2 immediate threats: that you're now losing blood and that the physical barrier of the epidermis has been compromised. As the blood vessels tighten to minimize the bleeding in a process known as vasoconstriction, both threats are averted by forming a blood clot. A special protein known as fibrin forms crosslinks on the top of the skin, preventing blood from flowing out and bacteria or pathogens from getting in. After about 3 hours of this, the skin begins to turn red, signaling the next stage, inflammation. With bleeding under control and the barrier secured, the body sends special cells to fight any pathogens that may have gotten through. Among the most important of these are white blood cells, known as macrophages, which devour bacteria and damaged tissue through a process known as phagocytosis, in addition to producing growth factors to spur healing. And because these tiny soldiers need to travel through the blood to get to the wound site, the previously constricted blood vessels now expand in a process called vasodilation. About 2 to 3 days after the wound, the proliferative stage occurs, when fibroblast cells begin to enter the wound. In the process of collagen deposition, they produce a fibrous protein called collagen in the wound site, forming connective skin tissue to replace the fibrin from before. As epidermal cells divide to reform the outer layer of skin, the dermis contracts to close the wound. Finally, in the 4th stage of remodeling, the wound matures as the newly deposited collagen is rearranged and converted into specific types. Through this process, which can take over a year, the tensile strength of the new skin is improved, and blood vessels and other connections are strengthened. With time, the new tissue can reach from 50 to 80% of some of its original healthy function, depending on the severity of the initial wound and on the function itself. But because the skin does not fully recover, scarring continues to be a major clinical issue for doctors around the world. And even though researchers have made significant strides in understanding the healing process, many fundamental mysteries remain unresolved. For instance, do fibroblast cells arrive from the blood vessels or from skin tissue adjacent to the wound? And why do some other mammals, such as deer, heal their wounds much more efficiently and completely than humans? By finding the answers to these questions and others, we may one day be able to heal ourselves so well that scars will be just a memory.
Alzheimer's disease is a brain disorder that results in memory loss and not being able to perform normal daily tasks. Although there is no cure for Alzheimer's disease, there are medications available that will help with the symptoms of Alzheimer's disease and will help slow down the progression. Some of these medications include Aricept and Namenda. In moderate to severe Alzheimer's, Aricept and Namenda are often used together. In fact, many experts and professional organizations recommend the use of Aricept or other medications in the same drug class and Namenda together in moderate to severe Alzheimer's. Be sure to talk to your doctor or pharmacist if you are unsure about the safety or effectiveness of these medications. Alzheimer's disease is a brain disorder that results in memory loss and not being able to perform normal daily tasks. Although there is no cure for Alzheimer's disease, there are medications available that will help with the symptoms of Alzheimer's disease and will help slow down the progression. Some of these medications include Aricept and Namenda. In moderate to severe Alzheimer's, Aricept and Namenda are often used together. In fact, many experts and professional organizations recommend the use of Aricept or other medications in the same drug class and Namenda together in moderate to severe Alzheimer's. Be sure to talk to your doctor or pharmacist if you are unsure about the safety or effectiveness of these medications. If you haven't used your medicine for a while or stored it incorrectly, it is always good to check if it's still good to take. First, you should always check the expiration date on your medicine before taking it. Correctly dispose medicines that are out of date. Damaged medicine may make you sick, so do not take medicine that has changed color, smell, texture, or hardness. Also, avoid taking pills that stick together or that have cracks or chips. To prevent your medications from going bad, make sure to store it correctly. Most people store their medicine in a bathroom cabinet, but the heat and moisture from bathing can actually damage your medicine. Storing your medication incorrectly can make your medicine go bad and no longer work as well. Make sure to store your medicine in a cool, dry place that is not in direct light. As with all medicines, store them out of reach of children and make sure to ask your pharmacist about any specific storage conditions for your medicine. If you haven't used your medicine for a while or stored it incorrectly, it is always good to check if it's still good to take. First, you should always check the expiration date on your medicine before taking it. Correctly dispose medicines that are out of date. Damaged medicine may make you sick, so do not take medicine that has changed color, smell, texture, or hardness. Also, avoid taking pills that stick together or that have cracks or chips. To prevent your medications from going bad, make sure to store it correctly. Most people store their medicine in a bathroom cabinet, but the heat and moisture from bathing can actually damage your medicine. Storing your medication incorrectly can make your medicine go bad and no longer work as well. Make sure to store your medicine in a cool, dry place that is not in direct light. As with all medicines, store them out of reach of children and make sure to ask your pharmacist about any specific storage conditions for your medicine.
If you know an older left-handed person, chances are they had to learn to write or eat with their right hand. And in many parts of the world, it's still common practice to force children to use their proper hand. Even the word for right also means correct or good, not just in English, but many other languages too. But if being left-handed is so wrong, then why does it happen in the first place? Today, about 1/10 of the world's population are left-handed. Archaeological evidence shows that it's been that way for as long as 500,000 years, with about 10% of human remains showing the associated differences in arm length and bone density, and some ancient tools and artifacts showing evidence of left-hand use. And despite what many may think, handedness is not a choice. It can be predicted even before birth, based on the fetus's position in the womb. So if handedness is inborn, does that mean it's genetic? Well, yes and no. Identical twins who have the same genes can have different dominant hands. In fact, this happens as often as it does with any other sibling pair. But the chances of being right or left-handed are determined by the handedness of your parents in surprisingly consistent ratios. If your father was left-handed but your mother was right-handed, you have a 17% chance of being born left-handed, while two righties will have a left-handed child only 10% of the time. Handedness seems to be determined by a roll of the dice, but the odds are set by your genes. All of this implies there's a reason that evolution has produced this small proportion of lefties and maintained it over the course of millennia. And while there have been several theories attempting to explain why handedness exists in the first place, or why most people are right-handed, a recent mathematical model suggests that the actual ratio reflects a balance between competitive and cooperative pressures on human evolution. The benefits of being left-handed are clearest in activities involving an opponent, like combat or competitive sports. For example, about 50% of top hitters in baseball have been left-handed. Why? Think of it as a surprise advantage. Because lefties are a minority to begin with, both right-handed and left-handed competitors will spend most of their time encountering and practicing against righties. So when the two face each other, the left-hander will be better prepared against this right-handed opponent, while the righty will be thrown off. This fighting hypothesis, where an imbalance in the population results in an advantage for left-handed fighters or athletes, is an example of negative frequency-dependent selection. But according to the principles of evolution, groups that have a relative advantage tend to grow until that advantage disappears. If people were only fighting and competing throughout human evolution, natural selection would lead to more lefties being the ones that made it, until there were so many of them that it was no longer a rare asset. So in a purely competitive world, 50% of the population would be left-handed. But human evolution has been shaped by cooperation as well as competition, and cooperative pressure pushes handedness distribution in the opposite direction. In golf, where performance doesn't depend on the opponent, only 4% of top players are left-handed, an example of the wider phenomenon of tool sharing. Just as young potential golfers can more easily find a set of right-handed clubs, many of the important instruments that have shaped society were designed for the right-handed majority. Because lefties are worse at using these tools and suffer from higher accident rates, they would be less successful in a purely cooperative world, eventually disappearing from the population. So by correctly predicting the distribution of left-handed people in the general population, as well as matching data from various sports, the model indicates that the persistence of lefties as a small but stable minority reflects an equilibrium that comes from competitive and cooperative effects playing out simultaneously over time. And the most intriguing thing is what the numbers can tell us about various populations, from the skewed distribution of pawedness in cooperative animals to the slightly larger percentage of lefties in competitive hunter-gatherer societies. We may even find that the answers to some puzzles of early human evolution are already in our hands.
Seeing a different pill at the time of your refill can be very scary and frustrating. There may be a simple explanation as to why you're seeing a different pill. Knowing why your pill may look different at refill time can put your mind at ease. Medications can be produced and distributed by many different manufacturers. Your pill might look different because your pharmacy may have dispensed your medication from a different manufacturer. There is nothing to worry about. Even though they may look different, it is the same medication. There are ways to tell you are receiving the correct medication. It is best to check your medications before you leave the pharmacy. This way, if you have any questions about your medication, you can ask your pharmacist. Typically, the label will include the description of the medication, including the shape and color. Looking at the label is always a good way to tell if you're receiving the correct medication. As with all medications, ask your pharmacist any questions you may have.
Xarelto is a prescription medication used to prevent certain types of blood clots and strokes. Xarelto can be used in people who are having hip or knee replacement surgery and for people with an irregular heart rhythm. Xarelto, a blood thinner, belongs to a group of drugs called factor Xa inhibitors. Factor Xa is an enzyme required for blood to clot. Xarelto inhibits factor Xa, slowing down blood clot formation. This medication comes in tablet form and is usually taken once daily, with or without food. For people taking it for atrial fibrillation or an irregular heart rhythm, Xarelto is taken once daily with the evening meal. Common side effects include itching, muscle spasms, and bleeding.
Our story is about a girl named Iris. Iris is very sensitive. So much that she is always in tears. She cries when she's sad, when she's happy, and even tears up when things just get to her. She has special lacrimal glands to make new tears and special tubes called lacrimal puncta to drain old ones away. And she cries so much that she goes through 10 ounces of tears per day, 30 gallons a year. In fact, if you look closely, you'll see that she's crying a little bit all the time. The basal tears that Iris constantly produces form a thin coating of 3 layers that cover her and keep dirt and debris away. Right next to Iris is the mucus layer, which keeps the whole thing fastened to her. On top of it is the aqueous layer, which keeps Iris hydrated, repels invasive bacteria, and protects her skin, or cornea, from damage. And finally, there is the lipid layer, an oily outer film that keeps the surface smooth for Iris to see through and prevents the other layers from evaporating. Normally, Iris goes about her day without really noticing the basal tears doing their thing. That's kind of their whole point. But one day, she meets a girl named Onion. Iris is immediately smitten. Onion looks gorgeous in her bright purple jacket, and she smells terrific. So Iris invites Onion to her house for dinner. But when she comes in and takes off her jacket, something terrible happens. You see, when Onion's jacket is removed, a chemical reaction happens, converting the sulfoxides that made her smell so great into sulfenic acid, which then becomes a nasty substance with a long name. Synpropanethiol S-oxide. The gas stings Iris, and suddenly she can't help it. She starts weeping uncontrollably. These reflex tears are different from the basal tears that Iris is used to. Because they're designed to wash away harmful substances or particles, they're released in much larger amounts, and their aqueous layer contains more antibodies to stop any microorganisms that may be trying to get in as well. Both Iris and Onion are devastated. They know they can't continue their relationship if Iris is going to hurt and cry every time Onion takes off her jacket, so they decide to break up. As Onion walks out the door, Iris stops crying and immediately starts again. Only now she's not crying reflex tears, but emotional tears. When someone is either too sad or too happy, it feels like a loss of control, which can be dangerous. So emotional tears are sent in to stabilize the mood as quickly as possible, along with other physical reactions such as an increased heart rate and slower breathing. But scientists still aren't sure exactly how or why the tears themselves are helpful. They may be a social mechanism to elicit sympathy or show submission. But some studies have also found that emotional tears contain higher levels of stress hormones, such as ACTH and enkephalin, an endorphin and natural painkiller. In this case, emotional tears are also directly calming Iris down, as well as signaling her emotional state to others. Sorry things didn't work out with Onion, Iris, but don't worry. As long as you have all three kinds of tears working to keep you balanced and healthy, it will get better. You'll see.